Can a lumbar disc bulge get worse? And how can you prevent it? That's the focus of today's episode of Ask Dr. Walter Salubro. If you're new to this episode and you're wondering what I'm doing, well, essentially I'm taking a question from a comment that may be one of your comments if you leave a question, and I'll answer that in a video format and upload it each and every day. That's what I plan to do. And today is episode number 9. It's a very straightforward question, and this gives me a chance to connect with you a bit more on a personal level in an informal setting, as you can see, versus long form lecture style videos, which I still plan to do on a weekly basis. So you're not going to miss out on that. And in case you're new to this, do subscribe right now by clicking on that red button below, tap the notification bell. Like this, you don't miss out on these daily video updates from the Ask Dr. Walter series or from the weekly videos. Okay, so today is episode 9, and here's the question. It's pretty straightforward. I'm gonna get right into it because it's a very commonly asked question by a lot of people, and this is by, I like to show it right there. Okay, this is by Punith. The person's name is Punith, and what Punith asked is, how do you prevent a bulging disc from getting worse? Great question. So let's say that you've been diagnosed with a disc bulge, L405 disc bulge, L5S1 disc bulge, maybe a cervical spine disc bulge like C5, C6, or C4, C5, and perhaps it's doing well. There's little to no pain. You've recovered. You're getting back to your normal life, doing your normal activities. Things have stabilized. Well, how can you prevent that from getting worse? Well, there are certain things that you can do, okay? And I'm going to outline them in this video, okay? And these are the kind of things that we recommend to our patients. If this is the first time meeting me, my name is Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And first and foremost, what I would do with my patient is help them to stabilize the spine, get the spinal distortions as stabilized and corrected as possible to improve the actual load and weight distribution on the spine and prevent those discs from being either re-injured or consistently and repetitively injured as time goes on in the future, okay? So spinal correction is important, and corrective chiropractic care can provide that because there's techniques, non-surgical, non-operative, very conservative style corrective techniques that include posture correction, posture correction in terms of adjustments, posture correction in terms of exercises, and also traction techniques on the spine, okay? Full spine traction techniques, or even localized areas of traction techniques, okay? On top of that, we do spinal adjustments. That helps to keep the spine functioning well at the individual segments, okay? So keeping the spine functioning well and keeping the structure of the spine in as best alignment as possible and correct it if it's out of position through chiropractic care is one of the best ways to initiate the process of preventative care for getting that disc injury from being worse, okay? Now, number 2, I do believe that some type of exercises should be done to stabilize the corrections that have been done with the chiropractic adjustments and the chiropractic care. So we'll give our patients a variety of different exercises at different stages in their care with us. Things that include stretching for flexibility, mobility exercises like cat-camel, for instance. Then we'll get into stabilization exercises, which help stabilize the gluteal muscles, the lower lumbar extensors, the abdominal muscles. These can be planks, side planks, bridges, prone cross crawl, bird dog are some examples. And if you look at my video channel, I have a ton of videos on these types of exercises with demonstrations, and follow along if you wanted that, okay? And then third, okay, once someone's gone through a corrective program and they're doing some home exercises to stabilize and maintain that correction, number 3 that's required is some kind of maintenance as well, spanned out over several weeks or once a month, of some kind of corrective or maintenance, like chiropractic maintenance, for instance. Continue on with exercises on a weekly basis to help solidify that spinal stabilization and correction. And by keeping the muscle strong around the core on a spine that's been corrected and stabilized, helps prevent further injury down the road, okay? Now, 4 other things, lifestyle activities, okay? Even though the disc bulge is healed and there's no inflammation and you're doing well, you still have to be mindful of certain activities that may re-injure the discs. For instance, bending forward and picking things up, whether they're light or heavy, especially if it's improper form. Okay, I have a video on my channel on how to lift properly and using a lumbar spine technique to help support the spine in a proper way when bending to lift. So avoiding bending at the hips to lift heavy items. That increases the intra-abdominal pressure, increases the pressure on the discs, and can actually injure the discs. Avoiding certain exercises that may actually trigger disc injuries, like deadlifts, for instance. Okay. Also, avoiding or being mindful of twisting style movements and bending in a twisting formation. Okay. Repetitive movements of the spine on a regular basis, being sedentary and sitting on one spot over and over without activity or very little activity, or changing your positions. So essentially, just because things are well, it doesn't mean you can just not be mindful of your back and your lower lumbar discs. By keeping spinal correction maintained, by doing home exercises, by avoiding aggravating factors and being mindful, then these are great ways to actually prevent disc bulges from getting worse. Okay. Having said all that, there still may be some wear and tear on those discs over time, but it may not be in an accelerated fashion if you didn't do these types of preventative measures and corrective measures. So hope you found that useful in episode number 9 of Ask Dr. Walter Salubro. And remember, if you're new to this, do subscribe right now so you don't miss out these on a daily basis, or also my weekly lecture format style videos. And do go right here to get the previous, right there, the previous episodes of Ask Dr. Walter Salubro, so you don't miss out. Click on the playlist right there.